Gabe's Chemo Duck program is an educational resource program for kids going through cancer treatment. It's a comfort item that they can have to learn about what's going on with their procedures and things that they're in treatment. Medical play therapy is a way that we can play with kids to teach them about medical procedures, learn about their hospital environment. We can use real or toy equipment to do that, and it's a way for them to express themselves in a non-threatening way, a safe environment to learn about what's going on with their treatment, and it's a way for a child life specialist to be able to assess how they're doing and coping with their treatment and going through the hospital. The Chemo Ducks are used in medical play. He has a removable port on his chest, so this can actually come off. And if you can, it's hard to kind of see, but there's a little bit of a bump right here. That's to represent a port. So that's what patients can relate to. If they have a port as well, it would feel similar. And then when a port is accessed, it has a needle that goes in here and a bandage over the top. So kids can actually access their port by doing that. And then nurses typically put a syringe in here, and the kids can actually connect an empty syringe if they want. Sometimes we actually use liquid as well if they're interested in doing that, and then you can just kind of practice pushing the syringe through like they would with their medicine, like the nurses would, and then they can disconnect. I think Chemo Duck is really unique because I haven't found another resource that is just like this one and specific to oncology patients. So I think it's really important for them to have something that's just like them. And it's very comprehensive program with the booklets and the CD and everything that comes with it, so the kids have like a whole set to get them started when they're first diagnosed. I think it's really cool to see kids kind of make it their own. They come with the bandana and no hair, so when kids start to lose their hair, I've often seen them take the bandana off and then they can relate to the duck that way too, or there's a bandana included in the program, so they can wear the bandana and match their duck. So I think it's really unique that they can relate to them that way. I primarily use them with preschoolers because their imagination is pretty big. So, and to be able to do medical play with the duck and a 5-year-old is pretty special because they get to kind of play out all of their fears or all of their understanding of what's going on.